1. Cases of broken heart syndrome are increasing in some hospitals. 2. The rise in cases correlates with the pandemic's timeline. 3. Researchers say the stress of coronavirus, not coronavirus itself, may be the cause. New research from the Cleveland Clinic identified a link between COVID-19 and cases of broken heart syndrome. The study, published in JAMA Network Open on July 9, found a significant rise in cases in the U.S. after March 1. Broken heart syndrome, also known as stress-induced cardiomyopathy or Takotsubo syndrome, happens when part of your heart temporarily enlarges and doesn't pump well, while the rest of your heart functions normally or with even more forceful contractions. According to the American Heart Association, AHA symptoms are similar to a heart attack, but it's sparked by stress. While the AHA says broken heart syndrome is usually treatable, it can be fatal. The Cleveland Clinic study analyzed data from 1,914 patients at 2 Ohio hospitals who had acute coronary syndrome, an urgent heart issue. None of these patients tested positive for COVID-19. Researchers compared patients who sought care in March or April of this year to those who had similar health problems in 2018 and 2019. The researchers discovered that people were significantly more likely to experience broken heart syndrome during the pandemic. Specifically, instances of broken heart syndrome jumped up from 1.8% before the pandemic to 7.8% during the pandemic. These findings suggest that psychological, social, and economic stress related to the COVID-19 pandemic was associated with an increased incidence of stress cardiomyopathy, the study authors wrote, indicating that the disease itself is not directly responsible for this heart problem. The study's researchers don't think the increase is a coincidence. Lead study author Ankur Kalra, MD, Associate Professor of Medicine at the Cleveland Clinic, tells very well that the rise in cases is likely due to the current environment, with a complex interplay of psychological, social, and economic impact of the pandemic. Correlation doesn't equal causation. The researchers behind the study can't prove that the pandemic caused the rise in cases of broken heart syndrome, just that there was an increase after the pandemic began.